So Tiana's going to be talking with us about NanoMOF Theranostic devices for controlled delivery of neuropharmaceuticals to the brain.
Okay, I want to thank NanoMOF for funding this project at the stage when it was back with the NanoMOF idea. And so I'm going to show you the progress that we've made. So really we got inspired by this figure here about so-called next generation personalized medicine drug delivery system. And if you look at this figure and this cycle here, ideally you want to have a system that you can load with any kind of drug that you can deliver to any kind of tissue that you can administer to the patient. Then you can use that same drug delivery and imaging system for detection and diagnosis of a disease. In the case that the disease is detected or diagnosed, then you will somehow apply external stimuli to release the drug, then monitor how therapy is progressing, then evaluate again, is this disease eradicated or no? If it yes, you initiate cycle. If no, this drug delivery device somehow biodegrades. And so if you think about this idealized drug delivery system, you want something that you can incorporate molecular targeting and encapsulation of therapeutic agent, diagnostic imaging capabilities, release by trigger stimuli, and in the end, the thing should be biodegradable. And so our idea for this future drug delivery device was to start with the NanoMOFs. NanoMOFs are metal-organic framework nanoparticles, and they're actually very much different from all the nanoparticles that we've seen so far. So in the metal-organic nanoparticles, we have metal centers that are connected by the organic ligand. And through different synthetic procedures, you can modulate the size of this nanoparticle. And so in order to impart some kind of external stimuli responsiveness to this kind of particle, we thought about it as this organic ligand using molecules that will isomerize upon irradiation. And so this figure is in a sense a little misleading, but idea is basically that. Metal organic framework are very porous, so you can incorporate the drug into the framework. And then upon irradiation, you'll start, in a sense, like wiggling these ligands. So there is a shape shifting within the material, and then the material either breaks or the pore size changes, the drug gets released. And so currently, because we are ideally interested in using this as imaging agents as well, we, at the metal side, incorporate the manganese ion, and then as a linker, different variation of this manganese-isomerizable ligand. And you can see that as ligands are kept with the carboxylic acid moieties, they will then coordinate to the metal centers. And these are the SEM images of some of the nanoparticles that we made. And you can see that these nanoparticles are very nice uniform cubes, and that's what you expect for very nice crystalline NanoMOF nanoparticle. And we also confirmed by the dynamic light scattering that Rick Davis, who just left, generously helped us with, that these particles are about 130 nanometers in size. Okay, so this is all really nice, but so this is where our trouble starts. So now we have things. This is carboxylic acid coordinated to the manganese ion. You put this in the water, and things are going to fall apart. And so commonly, people, when they work with the NanoMOF nanoparticles, they go and they put the silicon shell on them. But we wanted to go in a different route because we want ideally this nanoparticle to be biodegradable. So we synthesized 3 different polymeric shells to put on this nanoparticle. And so one would be the polycaprolactone based, then one is polyethylene glycol based, and so this is the more hydrophobic shell, more hydrophilic shell, or this diblock shell that has both polycaprolactone and polyethylene glycol. And so we made 2 versions of it. Some of them are kept on both ends with the amines, and some of them are kept only on one end with the amines. And so now this allows us, through this amine functionality on a polymer, to coordinate to the free surface available, metal side of the nanoparticle, and then the amines on this outside end of the particle will now be available to coupling to affect signaling peptides or antibodies or to targeting functionality. And so here in this picture, we use thermogravimetric analysis to show that we attach this polymeric shell to the nanoparticle, and now we can look if the coating with a polymer shell actually improves the stability of the nanoparticle. And here we're looking at a version where we have a polycaprolactone as a shell. This is in a stimulated cerebrospinal fluid media, and we see that over the time of the week, we lose only about 14% of the material. And this really indicates that without irradiation, you can administer this today, and then patient can come in a week and you can still image and see where you are. And so this is really the big picture. So I've shown you actually basically all the results that we have. But this is the big picture. So we synthesize the NanoMOF. We establish the procedure for capping it with a biodegradable polymeric shell and for labeling with a targeting ligand. Now, next stage will be to optimize the loading procedure of an NanoMOF with the drug of the interest and then targeting the cells. And then the mechanism of action of drug release and biodegradability is shown here. So upon irradiation, we have a shape shifting within the NanoMOF that will cause the drug to be released from the nanoparticle, and then the polycaprolactone shell will degrade due to the pH and enzymes present in the cell. So the take-home message is that we've designed multifunctional, similar responsive nanoparticles. And the thing that we are really interested in is not maybe necessarily putting this in the clinic, but from the research perspective, at least what we see is that a lot of drugs fail in this translational stage because we really don't have ability to see what's happening. And so we really see this type of devices used in a clinical trials when you can deliver a drug, but then at the same time really monitor how is the action of the drug progressing. And ideally we don't want to really implant optical fibers in anybody's brain, but this future of Thernaostic drug delivery. And this project actually got originally inspired by this call from Department of Defense, where they were looking at the nanomedicine for drug delivery science, and particularly in the battlefield environment. We applied for this grant, didn't get it, but we'll come back. Also, our other plans are to apply to the NIH nanomedicine program and then Impart materials. And I'll take questions.
Just a quick question. I mean, how did you decide to use manganese?
So you can use other metals, but the reason why we decided to use manganese is there's a lot of iron nanoparticles out there that are used for MRI imaging. And Lou will probably know better, but iron is T1 contrast. T2. Manganese is T1 contrast. And so we can really use iron as a metal center as well, but manganese now gives us kind of a complementary imaging.
T1 imaging is a little more well developed and widely used than T2 imaging. It's better spread.
T2.
T1, yes.
So you're right about T2.
It's just clear.
Okay, you ready?
It hasn't been this developed.
Or you can use that and just hit this button here. Okay. All right, we'll get started with our next talk. Lisette Bickford will talk to us about minimally invasive medical devices for neoadjuvant pancreatic cancer therapy.
Hello, everyone. Before I get started talking about the information that's on my slides, I wanted to go ahead and give some background information as to my motivation for this research. Oh, I also wanted to thank ICTAS for